Dentistry has changed unbelievably. When I graduated dental school in 1984, dental implants were in their infancy. The whole implant field is now an entity in itself. What we can do with dental implants now and the success of dental implants now is incredible. There is a 25-year study that shows that a dental implant successfully placed 25 years ago, 98% of them will be in service today. That's amazing. It's almost to the extent now where I can tell a patient, when I do that particular service, when I put a tooth back in with a dental implant, that it will be there for life. That's unheard of back in 1984. That means that we can replace permanently what was missing. There is never a need now. Not only is the implant field amazing, but they've designed implants to work on patients that never could have them before. And what kind of patients couldn't have them before? Older patients, octogenarians, who've lost a lot of bone. They've been wearing dentures for 20, 30 years, and they're miserable. Their lives are happy, they're great, they're older, they're energetic, and they can't enjoy a meal anymore. And they've gone to the dentist and they might have asked about implants, and they were told, you don't have enough bone to support the implant. You'll have to graft some bone from your hip to develop enough bone for an implant. You know, very involved procedures. They have implants now that are 1/3 the size that we can put into a patient's mouth in an hour, and that day, an hour later, they'll have a denture that fits on top of those implants that they could use immediately. Their lives are changed, and it is an unbelievable service. I don't do lower dentures anymore without them, and I have converted so many patients who could not ever wear a lower denture and could not have implants before in an hour, and they're extremely grateful and extremely satisfied. That's a huge change in the whole dental field as far as I'm concerned. The whole dental implant field in general, where a patient would come in and have an implant done, and it would be a 6-month to a year process before the tooth could go in, that's changed. We can put an implant in and put a temporary crown on that tooth immediately, that day. They're not walking around with that missing tooth. I call it a dental do-over. If they lose their tooth, we can put it back. That's just tremendous. The machinery, the instruments that we have, the dental CAT scans that we can take, just allow us to do things in such an efficient and wonderful way that it's really changed the whole face of dentistry. And it's such a great time and such a great profession because of those things that I've encouraged my own children to go into the field because it's so exciting and there's so many things going on. There's a CAT scan machine that we have. It's called an iCat, that will not only scan the mouth and give us a 3D image of the whole jaw, the whole anatomy of the mouth, where the nerves run, the muscles run, all the landmarks, but we have software that will tell us exactly where to put the implants. And then software that goes to the laboratory that will make teeth fit on top of the implants, so that in an hour and a half, not only do we know where and what size implants to put into the patient's mouth, but we have the laboratory temporary bridge to cement right on top of it. It literally took a half a dozen appointments of 3 or 4 hour appointments to do what we can do in an hour or two now, with much more accuracy, much more precision, and almost no complications. It's an amazing, amazing software, an amazing instrument, and is fairly new, and will change the whole face of implant dentistry even further.